help me? I'm an Apple person, can't find.
What was yours? I don't know where they put it.
Right there on the desktop, in that folder that says Saturday.
Okay, here we go.
Ah, okay.
Maybe it's Cerebrolysin. Which one's yours? Go to sledge.
Thank you very much for the honor. Actually, this was to be presented by my wife. She is sitting here, but she asked me to do this job. Actually, we are working nowadays. I have seen experiments done largely on healthy animals, and we get the data coming out on healthy animals after traumatic brain injury. But in our lifetime situation, this is not the case. People have different kinds of diseases, and when they get injury, I believe that this is time to change our understanding and modulate the drug treatments. So this is a work supported by US Air Force Research Laboratory and European Office of Aerospace Research and Development and Swedish Strategic Research. And I have nothing to disclose. Actually, in the life of military, sleep deprivation plays a great role, and they have very little time to sleep. And that is one of the reasons for having depression, particularly in young female soldiers. But here we are doing experiments on males at the moment. And these are military data telling that if you have sleep of more than 7 hours, your performance is always better. The another data is also telling the same thing. 72 hours sleep deprivation decreases your ability to simple mathematics. And also the data shows here that 48 hours sleep deprivation also have the same things. And here you can see that 7 hours sleep gives good result in performance, and it is decreasing gradually. 4 hours sleep leads to this one. So your mental function is altered when you have sleep deprivation. And this has to do with neurochemical changes in the brain. Regarding head injury, I mean in soldiers it is quite common that they have head injury by firearms and many other modes. When they are sleep deprived, of course their ability to judge or performance will be decreased. So the question is, what will happen if these soldiers whose neurochemical changes are already in due to sleep deprivation can have different prognosis for the same kind of injury, or they will respond to same kind of drug treatment? This is our long-term project we are working on. And what happens in concussive head injury when you know very well, but just tell you that the skull is not fractured and brain is moving in the cranial compartment. So what is happening? That you have an injury on right side, but due to concussion, you have much more severe symptoms on the left side. We have devised a model in rat where the 114.6 gram weight is dropped over the parietal parietal skull, giving an impact of 0.224 Newton. And in this situation, we always see that the left uninjured side is much more damaged, loss of neurons, edema, and all this can happen. Here is an example of electron microscopy. You can see that left side is much more damaged. Water is accumulating here as compared to the injured right side. But not only the basic mechanisms of head injury, they are also affected by different temperatures. If the injury is occurring at cold, if the injury is occurring at hot environment, the pathophysiology is quite changing. I'm just showing some example here at 34 degrees Celsius compared to 5 degrees Celsius. You can see that cell changes were much more exacerbated than the injury occurring at 23 degrees Celsius, and this is the control group. So not only that, temperature is also a factor. Different kind of diseases like diabetes or hypertension, they are also factors, but I'm particularly pointing out here on sleep deprivation. So this is an example animal model of sleep deprivation where the animal is put on an inverted flower pot. This is a well established model in a water pool. So they do not have REM sleep. And so we use this for 24 and 72 hours. We have previously established mechanisms that they show neurological abnormalities, and we use concussive head injury, and then we try to treat them with a therapeutic drug called cerebrolysin. Nowadays we believe that one drug, one mechanism is over, because when we have injury on the head or any kind, there are millions of factors are involved. So we cannot use one particular drug that will block only one specific aspects. So therefore, this drug is composed, this has a well-balanced mixture of different neurotrophic factors and active peptide fragments. So this is a multimodal drug giving neuroregeneration and also enhancing neuroplasticity. We have a couple of papers using this drug, and we also got one of the top technological award in National Innovation Summit in 2013, where we have shown that this drug can reduce neuropathic pain. So you should see here that when the CHI was given 8 hours, the left side is showing much more leakage to the iodine, and also 12 hours and 24 hours compared to the right side. Now the question is, when we have given 72-hour sleep deprivation, you can see that the increase in blood-brain barrier permeability is much more greater than the SD was not there. So the sleep deprived animals given identical CHI have much more leakage to their brains, but the mechanisms are not changing. My point is that left side is also showing higher. Since a lot of data are there, I just want to show you in a table. I do not have pointers, so I have to use this anyway. Sorry about that. Well, you can see that the left side, after SD, there is dramatic increase in the barrier permeability and also the edema from 75 control and CHI 24-hour 80, it becomes 82. And right side is also increased, as well as the neural injury, number of cells showed in the cerebral cortex. When we have given cerebrolysin, this last two rows, you can see that the blood-brain barrier leak is gone down when we have given 7.5 milliliter after 120 minutes of head injury in 72-hour sleep-deprived rats. But here, 5 milliliter of the same drug was not that effective on all aspects. And 5 milliliter is much more effective when the animal received only CHI without SD. So the point is that when there are different denominators of injury, first is sleep deprivation, you have changes in the neurochemical environment in the brain. After that, you have given injury, so there are two factors combining. In that circumstances, same drug, same dose, same type is not doing any good. So either we have to increase the dose, I'm not showing the results, otherwise you can also give them nano delivery of the drugs, they are doing much better. And I can show you some simple histology, 24-hour CHI and CHI plus 72 hour, complete loss of neurons you can see in the parietal cortex, whereas you can see 7.5 milliliter given 2 hours after injury, and 24 hour you can see that we can still see many viable neurons, whereas CHI 24 hour, no SD, and given cerebrolysin 7.5 milliliter is almost near normal. We have tested our hypothesis at the electron microscopy, and you can see that vacuolation edema formation is higher in 24-hour CHI alone, that is much more exacerbated after sleep deprivation of 72 hours. And cerebrolysin treatment in higher dose is much more better, whereas the same dose in only CHI is even better than this one. So on the basis of these data that I show you, we can say that sleep deprivation is one of the important factors that can exacerbate the effect of injuries. And then we must understand or modulate the drug treatment given to normal CHI patient, because we have to consider that sleep deprivation is one of the important factors. Now we are working the timeline, and we have to see that how long after we can give the cerebrolysin and which route we have given intravenously, whether it is better if you give intracerebrally or other routes. after different times so that we can achieve good neuroprotection in a combination of sleep deprivation and brain injury. So I stop here and thank you very much for your attention.
That concludes the session. If you have any questions, we obviously have some time.
No questions?
So,
Thank you.
Thank you.
Thank you very much for the opportunity.